Hello, this is Dr. David Bilstrom from the International Autoimmune Institute at Brigham Memorial Hospital. Our next installment will be about genetics and why children and adolescents and young adults should be seen even if they don't have an autoimmune disease yet. Now, autoimmune disease runs in families, so when an adult is diagnosed with an autoimmune disease in a family, you know that other members of the family, including children, are more likely to get autoimmune disease. The studies have shown that if you can set the system by age 19, people don't develop the chronic diseases later on in life that they otherwise would. Even if the lifestyle choices that someone makes as an adult are not the best, they won't end up getting these chronic health issues because things were really put in place at a young age. Now, one thing nice about taking care of children is that they heal so much better than adults, so it's always a lot easier to help somebody the younger they are. Also, if you can help somebody really set their system well before conception, before they have their own children, you're able to pass on much cleaner genes, not only to your children, but the generation after that. There's actually at least a 2-generation effect, they call it transgenerational, that you can impact so that these things that run in families ideally stop running in families. So what we do at the International Autoimmune Institute is when we see parents with autoimmune disease, we talk to them about the increased risk their children have of autoimmune disease and immune dysfunction in general. So ideally, you like to test the children, find what is going on that could be driving them to the same place that their parents are at, go ahead and fix those issues, and not only do they feel a lot better and probably clean up a lot of issues that are causing some problems already, ear infections and strep throats and sinus infections, allergies, asthma, maybe they have some eczema going on already, maybe they have some constipation, maybe they have tummy aches, but also you're taking care of the things that are going to turn into autoimmune disease later on in life. And by being able to do that before they have their own kids, not only does that help their children be healthier, but their grandchildren as well. Thus, chronic diseases and autoimmune diseases that tend to run in families will hopefully stop running in the family. The best time to do preventative medicine and try to prevent these autoimmune diseases is by taking care of people when they're children, adolescents, or young adults. Remember, the body's always ready to heal. You just have to give it a chance.